Are you sick and tired of feeling sick and tired? My name is Dr. Terry Chaplin, and I head the Celebration Health Association in Bluffton, Ohio. And one of the most common complaints that we see, just like every other doctor, is fatigue and tiredness. Conventional medicine doesn't do very well with fatigue unless they find an underlying disease process, such as anemia or an underlying infection or something like that is treatable. However, what do you do when you come in and the tests are negative? We see that often. And sometimes the tests are negative, but they're just on the borderline, such as in the lower range of normal. We look at that a lot more carefully. And in complementary and alternative medicine, we like to see people come in with fatigue because we really have a plan that we can really help in almost all cases. One of the first things we look at when we're dealing with fatigue is the endocrine function. Now that's the adrenal glands. Now your adrenal glands send out a hormone called cortisol. And cortisol helps you deal with stress. If you're under a lot of stress or you kind of use up the available cortisol and your adrenal glands get tired, they can't keep up with the need that your body has. If that's the case, and we can test for this with a saliva test, then you can just boost up the cortisol, sometimes with pantothenic acid or sometimes with glandular preparations, and it can really help with boosting up your energy. Another diagnosis that is oftentimes missed is hypothyroidism, because many people come into our clinic, and I'm sure that's true with many other doctors. They have the typical symptoms of hypothyroidism, which includes fatigue and constipation and hair loss and dry skin and many other things. But they do the blood tests, and the blood tests are fine. At least they're in the normal range. They might be in the lower side of the normal range. We look at it more carefully. We do detailed questionnaires and do further testing, and many times we can find that there is a decrease in function in the thyroid gland, even if the basic blood tests are okay. If that's the case, we boost up the thyroid function and people feel much, much better. Another form of hormones that we see are the sex hormones. And for men, of course, that's testosterone, and women, the main ones are estrogen and progesterone. A lot of times people are low in their hormone function, particularly during the change of life. Now, the trouble is that the synthetic hormone treatments that are out there can cause side effects and can increase the risk, even with cancer in some cases. Now, instead of that, we use bioidentical hormones, which are from soy or sometimes from yams. And these are prepared by compound pharmacies, and they're prescribed by physicians like myself in very precise amounts, and you can boost up just enough to really correct the symptoms and boost up energy without increasing the risk significantly. We also do a lot to boost up the immune system. Nutritional therapies can do that. There's quite a few herbal supplements that can be helpful that way. And we also find that allergies are very, very common, much more so than people realize, because there's the obvious allergies, such as seasonal allergies and dust allergies that people are aware of. The food allergies are more subtle. They're more difficult to recognize. And we do testing to see if you're producing antibodies against foods, and then we eliminate those foods for a period of time to clear away kind of an allergic fog that develops, and then challenge back in with those foods one at a time, the ones that had positive antibodies. Now, if that causes symptoms, usually the symptoms are quite obvious, and then we know that we have allergies that need to be avoided, or we can desensitize. And there are several ways we can desensitize using natural means that do not involve the conventional desensitization techniques that most allergists use. Another aspect that we deal with is inflammation. Now, inflammation can be a problem with infections, or it can just kind of drag the system down. Inflammation of the digestive tract is very common. We have GERD, we have irritable bowel, we have many digestive issues that are not really treated very well by the conventional medications. And what we try to do is enhance normal function. Medications tend to block actions in the body, and if they block actions, they usually block actions you don't want to block. Now, they may have some beneficial effects, but the ones that you don't want to block are called side effects. And we see a lot of side effects from medications that are used for that purpose. Now, with nutritional therapies, you tend to build up the normal function. And so by enhancing the normal function, you rarely have side effects. Possible in some cases, but it's much more likely to have a good result. So if you're interested and you want more energy, we're very happy to talk to you about this and welcome you at the Celebration Health Center.